A 60-year-old patient is brought to the urgent care clinic with the complaint of pain, abdominal distension for past several weeks. The pain began with the change with bowel habits 3 months ago. He gradually defecated less until he becomes completely constipated, which leads to increasing pain and distension. He also mentioned he had lost weight during this period, even though he had not changed his diet. When asked about his family history, patient revealed his brother was diagnosed with colorectal cancer at age of 65. A abdominal radiograph and CT scan were done, which confirmed diagnosis of obstruction. Which of the following location in digestive tract is most likely involved in this patient's disease process? So what is the location of this patient having obstruction? Yes, yes. So the answer is sigmoid colon. So the patient is having, let's see what is given in the question. First of all, the patient is 60 years old, which is high, put them in high risk for having any colorectal cancer. The complaint of pain and abdominal distension for past several weeks. He has changed in his bowel habits, which becomes completely obstructed or constipated. And his brother was diagnosed with colorectal cancer, but he was diagnosed with the age of 65. And CT scan and abdominal radiograph shows obstruction. So here we have to learn certain points like what is the most common cancer in United States, what is a guideline by USPSTF regarding family members who have colon cancer. So first of all, there are in male there are three cancers we have to remember that is most common. Most common cancer is prostate cancer in United States. The second one is lung cancer, and the third one is colon cancer. While in female, the first one is breast cancer, the second is lung, and the third is colon. So now as we got this one, we have to remember what can be done by physician to decrease the risk or to early detect this cancer. As we all know, prostate cancer can be diagnosed very early via having digital rectal examination or screening for PSA. Breast cancer in women can be diagnosed via mammography and other modalities, and it's very curable. While lung cancer, which is very hard to diagnose, causes it takes first place in United States in both male and female as the #1 killer for cancer related deaths. So lung, prostate and colon is a sequence for male that are dying from cancer, while in female it will be lung, breast and colon, the sequence for females that are dying from cancer related. So what can be done with this third most common cancer? So US government, like they have USPSTF, that is Preventative Task Force, that came up with the regulation that all adults at the age of 50 years old, they should do colonoscopy. All adults with 50 years of old, they should do colonoscopy. And if there is a family history of first relative with the having colon cancer, they should either do before the 10 years of the relative's age of diagnosis. Like, let's suppose his brother was diagnosed at 65, so he can do his colonoscopy at 55 years old or at 40 years of age. So if the patient has a history of family history of getting colon cancer, they should start doing colonoscopy at 40 years or 10 years before the age of diagnosis, whichever comes first. So you understand this timeline, everyone? So you have to remember, USPSTF, they require to do colonoscopy in every patient beginning at the age of 50. Yeah.
Thanks for watching. Please give a thumbs up and subscribe for more.